Hi, I'm Carmen Goojha. I'm a family physician here on the Sunshine Coast. I'm here in Shíshálh right now, and I work here at Carrie Clinic, just behind me. This is the green sleeve. This is what a collaborative group have come up with together. So the Sunshine Coast Hospice Society, the Shíshálh Nation, the Division of Family Practice and BCEHS have all worked together to come up with this. So this is a very handy packet that has all of the important information that your healthcare providers and your loved ones need to make medical decisions on your behalf if you can't make them or voice them on your own. It includes a face page which has a little checklist of all the documents that you've completed and that are actually in the sleeve. So you're going to have obviously your name and your care card number. You're going to have a list of your emergency contacts and substitute decision makers and how to get a hold of them. You'll have your representation agreements, which are just formal papers stating who you have chosen to make medical decisions on your behalf if you can't make them on your own. A list of your medications. You're going to have the medical orders of scope of treatment form or a no CPR form, preferably it's the most form, and you complete it with your family physician or your nurse practitioner. And it says whether or not, if you passed away, if you would want any chance at resuscitation. It's really hard to think about getting sick. It's really hard to think about dying. Like, these are things in our culture that are thought of in such a negative way, and they're hard. But the more we talk about it, the easier it gets. Key things you need to know when helping your patients navigate the green sleeve is to educate them about their disease trajectories, what treatments and interventions might be offered to them, explore with them what their beliefs and values are, and often through that discussion you figure out what kind of treatments are and are not acceptable to them. A good time to start a goals of care conversation is as soon as possible. We can start these conversations very simply with young, healthy patients with a simple, if something were to happen unexpectedly, a crisis situation, an accident, who would you want to make your medical decisions on your behalf? Am I okay with going to long-term care? Am I not? What's the threshold for that? And also wrapping your head around the idea that you are likely going to get to a point where you are going to need care beyond what your loved one can give. And I think it also gives the family member an opportunity to prepare as well. What are they prepared to do? What can they provide for their loved one when it comes to nursing care? Always asking permission, are you okay if we talk about this? And meet them where they're at. And sometimes people aren't ready, and that's okay. So it's a guided decision. Take that extra stress off. It's really a gift that you give to your loved one, to your healthcare team, but also to yourself.